Welcome to our exploration of health economics and resource allocation. In today's world, healthcare systems face the challenge of providing quality care while managing limited resources. Health economics helps us understand how these resources are distributed and used efficiently. By examining costs, benefits, and outcomes, we can make informed decisions that impact public health. This video will guide you through the basics of health economics, why resource allocation matters, and how these concepts shape healthcare policies. Let's begin by understanding what health economics is and why it's so crucial in today's society. Health economics is a branch of economics focused on issues related to efficiency, effectiveness, value, and behavior in the production and consumption of health and healthcare. It examines how healthcare resources are allocated, including money, time, and labor. By analyzing these factors, health economics aims to improve the delivery and quality of healthcare services. This field also considers the impact of health policies and interventions on population. Understanding health economics is essential for policymakers, healthcare providers, and patients alike, as it influences decisions at every level of the healthcare system. Resource allocation is a critical aspect of health economics because resources like money, medical staff, and equipment are limited. Deciding how to distribute these resources can affect the quality and accessibility of healthcare. For example, should more funds go to preventive care or to treating chronic diseases? These decisions have real-world consequences for patients and communities. Effective resource allocation ensures that the greatest health benefits are achieved with the available resources. It also helps reduce waste and improve overall system performance, making healthcare more sustainable. Healthcare resources can be divided into several categories: financial, human, and material. Financial resources include funding from governments, insurance, or out-of-pocket payments. Human resources refer to doctors, nurses, and other healthcare workers. Material resources include medical equipment, medications, and facilities. Each type of resource plays a vital role in delivering care. Efficient management of these resources is essential to ensure that healthcare systems can meet the needs of their populations, especially during times of crisis or increased demand. Scarcity is a fundamental concept in economics, including health economics. Because resources are limited, every decision involves an opportunity cost, the value of the next best alternative that is foregone. For example, if a hospital invests in new technology, it may have to delay hiring more staff. Understanding opportunity cost helps healthcare leaders make better choices about where to allocate resources for the greatest benefit. This concept is central to making tough decisions in healthcare, where the needs often exceed the available resources. Efficiency means getting the most health benefit from the resources available. In healthcare, this involves providing high-quality care at the lowest possible cost. Efficiency can be improved by reducing waste, streamlining processes, and using evidence-based practices. For example, using generic medications instead of brand-name drugs can save money without compromising care. Efficient healthcare systems are better able to serve their populations and adapt to changing needs. Equity is about fairness in the distribution of healthcare resources. It means ensuring that everyone has access to the care they need, regardless of their background or income. Sometimes achieving equity requires allocating more resources to disadvantaged groups. For example, rural areas may need extra support to provide the same level of care as urban centers. Equity is a key goal in health economics, as it promotes social justice and improves overall health outcomes. Cost-effectiveness analysis is a tool used in health economics to compare the costs and benefits of different healthcare interventions. It helps decision-makers choose options that provide the most health benefit for the least cost. For example, a cost-effectiveness analysis might compare the value of a vaccination program to that of a new cancer treatment. This approach ensures that limited resources are used where they can do the most good. Quality-adjusted life years, or QALYs, are a measure used to assess the value of medical interventions. QALYs combine the quantity and quality of life gained from healthcare treatments. For example, a treatment that adds 1 year of perfect health is worth 1 QALY. This measure helps policymakers compare the effectiveness of different interventions and allocate resources more efficiently. QALYs are widely used in health economics to guide funding decisions. Budget impact analysis evaluates how a new healthcare intervention will affect the overall budget of a healthcare system. It considers the costs of implementing the intervention and the potential savings from improved health outcomes. This analysis helps decision makers understand whether a new treatment or program is affordable and sustainable within existing financial constraints. Budget impact analysis is an important tool for managing healthcare resources effectively. Demand for healthcare services is influenced by factors such as population size, age, income, and health status. On the supply side, the availability of healthcare providers, facilities, and technology determines how much care can be delivered. Health economics examines the balance between demand and supply to ensure that resources are allocated where they are most needed. Understanding these dynamics helps policymakers plan for future healthcare needs. Market failure occurs when the free market does not allocate healthcare resources efficiently. Common causes include information asymmetry, externalities, and public goods. For example, patients may not have enough information to choose the best treatment, or vaccinations may benefit society beyond the individual. Health economics addresses market failures by recommending policies such as regulation, subsidies, or public provision of services. Governments play a vital role in health economics by funding healthcare, regulating providers, and ensuring access to essential services. They set policies that influence how resources are allocated and monitor the quality and efficiency of care. Public health programs, insurance schemes, and subsidies are examples of government interventions. Effective government involvement helps address market failures and promotes equity in healthcare. Health insurance is a key mechanism for pooling risks and sharing healthcare costs. It helps protect individuals from high medical expenses and ensures access to care. Health economics studies how insurance affects resource allocation, including which services are covered and how providers are paid. Well-designed insurance systems can improve efficiency and equity, but poor design may lead to overuse or underuse of services. Payment systems determine how healthcare providers are compensated for their services. Common models include fee-for-service, capitation, and bundled payments. Each system has different incentives and impacts on resource allocation. For example, fee-for-service may encourage more services, while capitation promotes cost control. Health economics analyzes these systems to find the best balance between quality, efficiency, and cost. Health technology assessment evaluates the value of new medical technologies, such as drugs, devices, or procedures. It considers clinical effectiveness, cost, and impact on health outcomes. This process helps decision-makers determine which technology should be adopted and funded. By using technology assessment, healthcare systems can allocate resources to innovations that offer the greatest benefit. Priority setting involves deciding which health services or interventions should receive funding and attention. This process is guided by criteria such as cost-effectiveness, equity, and population needs. Priority setting helps ensure that limited resources are used where they can have the greatest impact. Transparent and fair processes are essential for building trust and legitimacy in healthcare decisions. Ethical considerations are central to resource allocation in healthcare. Decisions must balance efficiency, equity, and respect for individual rights. For example, how should scarce resources like organ transplants be distributed? Ethical frameworks help guide these tough choices, ensuring that decisions are fair and justifiable. Health economics incorporates ethical principles to support responsible resource allocation. Healthcare systems can be publicly or privately funded and delivered. Public systems are typically funded by taxes and aim to provide universal coverage, while private systems rely on individual payments or insurance. Health economics compares these models to assess their impact on efficiency, equity, and resource allocation. Each system has strengths and challenges, and many countries use a mix of both. Global health economics examines how resources are allocated across countries and regions. It addresses issues such as international aid, disease control, and access to essential medicines. Differences in wealth, infrastructure, and health needs create unique challenges for resource allocation. By studying global health economics, we can develop strategies to improve health outcomes worldwide and reduce health disparities. Social determinants such as income, education, and environment influence health outcomes and resource needs. Health economics considers these factors when allocating resources, aiming to address underlying causes of poor health. For example, investing in education or housing can improve health more effectively than medical care alone. Addressing social determinants is key to achieving better health for all. Resource allocation often involves choosing between preventive and curative care. Preventive care, such as vaccinations and screenings, aims to stop diseases before they occur. Curative care treats illnesses after they develop. Health economics evaluates the cost-effectiveness of both approaches to determine the best use of resources. Investing in prevention can reduce long-term costs and improve population health. Planning for the health workforce involves ensuring that there are enough qualified professionals to meet population needs. Health economics analyzes trends in workforce supply and demand, training requirements, and geographic distribution. Effective workforce planning helps prevent shortages or surpluses and supports efficient resource allocation. It's essential for maintaining high-quality care and adapting to changing health challenges. Health system performance is measured by indicators such as quality, efficiency, access, and equity. Health economics uses these metrics to evaluate how well resources are being used. Continuous monitoring and improvement help ensure that healthcare systems deliver the best possible outcomes. Performance measurement supports accountability and guides future resource allocation decisions. Economic evaluation methods such as cost-benefit, cost-effectiveness, and cost-utility analysis are used to compare healthcare interventions. These methods help determine which options provide the best value for money. By systematically assessing costs and outcomes, economic evaluations support evidence-based decision-making and efficient resource allocation. Health policy and economics are closely linked. Policies set the rules for how resources are allocated and care is delivered. Health economics provides the evidence and analysis needed to design effective policies. By working together, policy and economics can improve health outcomes and ensure that resources are used wisely. Pandemics create unique challenges for resource allocation. Sudden increases in demand for care, equipment, and staff require rapid and flexible responses. Health economics helps prioritize resources such as vaccines or ventilators to maximize public health benefits. Lessons from pandemics can inform future planning and strengthen healthcare systems. Innovation drives improvements in healthcare, but new technologies and treatments can be expensive. Health economics evaluates the value of innovations and guides decisions about which to adopt. Balancing innovation with affordability is key to sustainable resource allocation. Encouraging cost-effective innovation ensures that healthcare systems continue to improve without overspending. Patient preferences and values are increasingly recognized in resource allocation decisions. Involving patients in decision-making can improve satisfaction and outcomes. Health economics uses tools like discrete choice experiments to understand what patients value most. Incorporating patient preferences helps ensure that resources are used in ways that reflect community needs. Reliable data and evidence are essential for effective resource allocation. Health economics relies on data from clinical trials, surveys, and health records to inform decisions. Evidence-based allocation improves transparency and accountability, ensuring that resources are directed to interventions that work. Investing in data systems supports better decision-making. Resource allocation is especially challenging in low-income settings, where resources are extremely limited. Health economics helps identify the most cost-effective interventions and prioritize basic health needs. International support and innovative financing can help bridge gaps. Addressing these challenges is vital for improving global health equity. Aging populations increase demand for healthcare services, especially for chronic diseases and long-term care. Health economics analyzes how to allocate resources to meet the needs of older adults. Strategies include investing in preventive care, supporting caregivers, and adapting health systems for an aging society. Planning for demographic changes is essential for sustainable healthcare. Mental health is an important but often underfunded area of healthcare. Health economics evaluates the costs and benefits of mental health interventions, aiming to improve access and outcomes. Investing in mental health can reduce overall healthcare costs and enhance quality of life. Resource allocation should reflect the significant impact of mental health on individuals and society. Hospitals must allocate resources such as beds, staff, and equipment to provide effective care. Health economics supports hospital managers in making decisions about service lines, staffing, and technology investments. Efficient hospital resource allocation improves patient outcomes and operational performance. Continuous evaluation helps hospitals adapt to changing needs. Pharmaceutical economics examines the costs, benefits, and access to medications. Health economics evaluates drug pricing, reimbursement, and the impact of new therapies. Balancing innovation, affordability, and access is a key challenge. Effective pharmaceutical resource allocation ensures that patients receive the medications they need without overwhelming healthcare budgets. Primary care is the foundation of effective healthcare systems. Health economics supports the allocation of resources to primary care services, such as family medicine, preventive care, and chronic disease management. Strengthening primary care improves health outcomes and reduces the need for expensive hospital care. Investing in primary care is a cost-effective strategy for health systems. Rare diseases present unique challenges for resource allocation due to high treatment costs and small patient populations. Health economics evaluates the value of investing in treatments for rare diseases, considering both individual and societal benefits. Policies may include special funding or incentives for research and development. Balancing equity and efficiency is crucial in this area. Public health focuses on population-wide interventions such as vaccination campaigns and health education. Health economics helps allocate resources to public health programs that offer the greatest benefit. Investing in public health can prevent disease, reduce healthcare costs, and improve quality of life. Effective resource allocation supports healthier communities. Chronic diseases like diabetes and heart disease require long-term management and resources. Health economics evaluates the cost-effectiveness of interventions such as medication, lifestyle programs, and monitoring. Allocating resources to chronic disease management can reduce complications and hospitalizations, improving both health outcomes and system sustainability. Emergency care requires rapid allocation of resources to save lives. Health economics supports planning for emergency services including ambulance systems, trauma care, and disaster response. Efficient allocation ensures timely care and maximizes survival rates. Preparedness and flexibility are key to effective emergency resource management. Preventive services, such as screenings and immunizations, are essential for reducing disease and healthcare costs. Health economics evaluates the cost-effectiveness of preventive programs and guides resource allocation. Investing in prevention can yield significant long-term savings and improve population health. Health promotion activities encourage healthy behaviors and lifestyles. Health economics supports investment in programs such as smoking cessation, nutrition education, and physical activity. Allocating resources to health promotion can prevent disease and improve quality of life, benefiting both individuals and society. Health infrastructure includes hospitals, clinics, and technology systems. Health economics evaluates investments in infrastructure to ensure they meet population needs and support efficient care delivery. Well-planned infrastructure allocation improves access, quality, and system resilience. Health economics is evolving with advances in technology, data analytics, and personalized medicine. Future trends include greater use of artificial intelligence, telemedicine, and value-based care models. These innovations will shape how resources are allocated and improve health outcomes. Staying informed about trends helps healthcare leaders plan for the future. Summary: health economics and resource allocation are essential for creating efficient, equitable, and sustainable healthcare systems. By understanding costs, benefits, and outcomes, we can make better decisions about how to use limited resources. Whether it's through policy, innovation, or patient involvement, health economics provides the tools needed to improve health for all. Thank you for joining us on this journey through health economics and resource allocation.